Welcome to the Therapy Trainings Podcast, where we dive deep into the world of mental health and wellness, providing insights and tools for professionals like you. Today, we are focusing on a vital topic that impacts many of our clients: aging and long-term care. This episode serves as a companion to the course titled 3C Hours Aging and Long-Term Care, offered by Therapy Trainings. Throughout our time together, you'll discover key points from the course and gain additional insights into how we can better support our aging population and those who care for them. As we age, our bodies and minds undergo significant changes. These transformations can often lead to a variety of mental health challenges, both for the individuals experiencing them and for their caregivers. In this episode, we'll discuss the unique mental health implications of aging, the emotional toll on caregivers, and some common misconceptions surrounding aging and long-term care. By the end of our discussion, you'll have a clearer understanding of how to approach these issues in your practice and how to best support your clients and their families. Let's start with the aging process itself. Aging is not just a biological phenomenon. It's also a psychological and social experience. The course emphasizes that while many people view aging as a decline, it can also be a time for growth and resilience. In fact, research suggests that older adults often report higher levels of life satisfaction compared to younger individuals. Isn't that fascinating? This perspective shift is essential for mental health professionals to understand because it allows us to reframe our approach. Instead of focusing solely on decline, we should also be looking for areas of strength and resilience in our older clients. For instance, consider the concept of successful aging. This term refers not only to the absence of disease or disability, but also to the maintenance of cognitive and physical function and the engagement in social and productive activities. When we frame our conversations around successful aging, we empower our clients to embrace their journey and focus on what they can control. So how can we, as therapists, foster this mindset in our clients? One way is through validating their experiences and encouraging them to share their stories. Storytelling can be a powerful tool in therapy, particularly for older adults. It allows them to reflect on their lives, make sense of their experiences, and find meaning in their aging process. For example, a client might share a story about a challenge they faced in their younger years and how they overcame it. By drawing on these past experiences, they can find strength and resilience in their current situation. Encouraging clients to reflect on their life narratives not only boosts their self-esteem, but also reinforces their identity and sense of purpose. Now, let's turn our focus to caregivers. Caregiving for aging loved ones can be incredibly rewarding, but also extremely challenging. The course highlights the emotional toll that caregiving can take, leading to increased stress, anxiety, and even depression among caregivers. This is a crucial point for mental health professionals to consider, as caregivers often neglect their own mental health while focusing on the needs of their loved ones. To illustrate this, let me share a story about a client I worked with who was the primary caregiver for her elderly mother. She came to therapy feeling overwhelmed and guilty for wanting time away from her mother. Through our sessions, we explored her feelings and the concept of self-care. We discussed the importance of setting boundaries and recognizing that taking time for oneself is not selfish, it's necessary. By helping her understand that her well-being directly impacted her ability to provide care, she gradually learned to prioritize her needs. This not only improved her mental health, but also enhanced her caregiving abilities. How can we better support caregivers in our practice? First, we can offer them a safe space to express their feelings without judgment. Second, we can educate them about the importance of self-care and provide practical strategies for incorporating it into their daily routines. Additionally, connecting them with support groups can provide a valuable community where they can share experiences and receive encouragement from others in similar situations. Now, let's address some common misconceptions surrounding aging and long-term care. One prevalent myth is that all older adults experience cognitive decline. While some cognitive changes are a normal part of aging, not every older adult will suffer from dementia or severe memory loss. In fact, many older individuals retain sharp cognitive abilities well into their later years. As professionals, it's crucial for us to challenge this stereotype and focus on the individual strengths and capabilities of our clients. Another misconception is that older adults are not interested in therapy or mental health support. This is simply not true. Many older adults are eager to engage in therapy to address issues like grief, anxiety, or adjustment to life changes. It's our responsibility to reach out to this demographic and provide accessible resources that meet their needs. Now, let's dive into some additional insights that can enhance your work with aging clients. One key aspect that often gets overlooked is the role of technology in the lives of older adults. While it's easy to assume that this population is not tech-savvy, many are embracing technology to stay connected with family and friends, access information, and even participate in teletherapy. Encouraging your clients to explore technology can enhance their social connections and provide new avenues for support and engagement. Additionally, consider the cultural factors that may influence how aging is perceived and experienced. Different cultures have varying views on aging, with some placing great emphasis on respect for elders and others focusing more on independence. Understanding these cultural nuances can help you tailor your approach and provide more culturally sensitive care. As we wrap up today's discussion, let's reflect on the profound impact we can have on our aging clients and their caregivers. By fostering resilience, promoting self-care, and challenging misconceptions, we empower individuals to embrace the aging process with dignity and confidence. I encourage you to consider how you can incorporate the insights from this episode into your practice. Whether it's through storytelling, validating caregiver experiences, or exploring the role of technology, there are myriad ways to support those navigating the complexities of aging and long-term care. For further learning and resources, I invite you to visit therapytrainings.com, where you can explore the course 3 Hours Aging and Long-Term Care, and many other valuable offerings. Remember, our role as mental health professionals is not just to treat, but to inspire and empower our clients to lead fulfilling lives, regardless of age. Thank you for joining me today on the Therapy Trainings podcast. I hope you found this discussion insightful and that it inspires you to continue your important work in the field of mental health. Until next time, take care and keep making a difference.